Okay, John, it's all yours.
All right, so I'm just going to go into the share screen. And did that work? Everyone should have full screen on that?
Yep.
Okay.
Yes.
Yep. All right, so we're going into the Gua Sha workshop. We're doing a little bit of a review here. So the workshop goal for today is to review the technical practice of Gua Sha using the jade roller and the Gua Sha stone with a specific focus on support of the head and neck and the face. So just a little bit of a review. What is it? So Gua Sha literally translates into scraping sand. And this refers to when you're doing Gua Sha, you'll often notice little red dots of blood appear under the skin. Again, you're not trying to break the skin, but that's just what the term refers to. It's an ancient form of self-care common to Chinese medicine, and it's often combined with other modalities, moxibustion, Tui Na, and a number of others. And when we say Gua Sha, it doesn't specifically mean the tools that you're going to be receiving. There's a whole variety of materials, and all of those can be used for Gua Sha. So here are a number of different implements that can be used. The one on the upper left that's black is the bien stone. There's an ox horn, and the upper right is the copper scraper. On the lower left, we've got the jade roller and the stone, similar to what I believe everyone should be getting. There's a porcelain soup spoon. Next to that is a lid to a jar, baby food jar or a spice jar. Either of those work. And even coins have been used for Gua Sha as well. And now for the upper part of the body, these are some pictures that I've added. In addition to using the Gua Sha tools, you can also use different combs. The ones in the upper row are of ox horns. The one on the lower left is sandalwood. The black one is a comb made of the bien stone again. And then the two on the bottom right are both made of jade. And so just going back into the 8 branches of care for Chinese medicine, Gua Sha is just one of all these different modalities, and they can all be combined. Some people specialize in certain ones to try to optimize the efficiency. So going into a little bit more of Chinese medicine theory in this workshop, the concept of yin and yang, they're basically two relative components, and that basically means that there's no absolute yin or absolute yang. It all depends on what you're comparing it to. So I just have some yang associated things over on the left and yin over on the right. So you can see day and night, above and below, exterior, interior, hot and cold, qi and blood. In terms of nature, things that are more dry and windy would be considered yang, wet or still would be yin, and just in general, energetic and lethargic is things that would respectively be associated with yin and yang. So as that relates to the head is in the upper part of the body. That would be generally considered yang relative to the other parts. And it's most commonly afflicted by problems that are yang in nature, such as emotions, acuity of the senses, excess energy that is blocked or otherwise not able to be appropriately directed. And yang acupuncture channels often connect to the head. So again, these things are more yang. Again, the emotions, the senses, these are things that are just very, very fine-tuned as opposed to just by comparison, things that are more associated with the physical tissues of the body or hair or more body fluids, nails, those kind of things. They're a little bit more coarse and less abstract. So indications, just again with a review, why use Gua Sha? The tools can stimulate the tissue more precisely than bare hands. You get better leverage, and is primarily used for problems of pain, stiffness, limited mobility, tight skin, scars, stretch marks, cellulite, even fat can have adhesions and respond well to Gua Sha. Blood stasis, according to Chinese medicine, would actually, again, fall into that category. Even fat has certain characteristics of blood, according to Chinese medicine theory. And conditions that are cold or more yin are often better addressed by adding heat or cupping as opposed to applying the Gua Sha. Part of the reason for that is because when you're adding oils, the oils are considered more yin, it's more viscous, and those kind of things can basically block the yin, because it takes yang from your body and energy to metabolize the oil. So if people are lethargic or too cold, the oils may be a little bit excessive for the body to metabolize. Cautions, contraindications, open wounds, rashes, blemishes, difficulty clotting, pregnancy, varicose veins. Don't use forcefully over veins. And especially now as we're working up on the neck area, you have the arteries and blood supplies going up to the head. So veins and circulation, you generally don't want to work too deeply with short strokes into the neck. It's better to work more superficially. So tips for the head and the neck. It's generally a fairly safe area to work on. There are some specific considerations. The upper part of the body does well when it's moderately light and dry without wind. So basically, if you're doing Gua Sha, you don't want to be exposed to wind and cold shortly afterwards. And you also don't want to use too much oil. It can smother the skin. It can run down the forehead into the eyes, especially if you have oily skin. You don't want to be aggressive with a Gua Sha stone. Let's see, on the hair, as it can damage the hair or chafe the skin. And the jade roller can work on long hair if the hair is tied back, or if it's too short. But otherwise, if you have curly hair or you're not able to keep it in place, it might get stuck in the roller. So that is where the combs tend to work as well, or any kind of just massage of the scalp. Other tools can work as well. So if you're uncertain, brushing or combing can also be effective. So general considerations for the tools, just a bit of a review. Plain unscented oils are usually pretty good. You don't want the oil to get absorbed too quickly in the skin. So sometimes essential oil extracts tend to get absorbed more quickly. So I usually recommend something that's edible. It usually has a good viscosity: sesame oil, sunflower, cooking oil, or olive oil. And again, the extra virgin olive oil, I found at least some brands tend to get absorbed too quickly to be effective. So methods, areas for today will be recommended to help improve the posture of the neck, reduce stress, and improve clarity. They fall into 3 categories. One, it would be improving the occipital tilt, releasing tension in the posterior neck, and supporting overall corrections using common distal points. So let's see if I can, so for the first one we're going to work on, or that I'll talk about, again, since we don't have all the tools, would be governing vessel 16. So the governing vessel channel is an acupuncture channel that runs up the spine from the tailbone, goes over the top of the head, and then connects to the upper jaw. Point 16 of the channel is at the base of the skull, and it's a good area to start to release before working on other areas. Using any Gua Sha tool, work again up the back of the neck and over the top and forward. If any areas feel tight when you're tucking your chin, you can start with that area first. So I'm just going to stop share just for a second and just kind of demonstrate on myself this point here. So again, it's the base of the skull. You can generally follow from the lower tip of the ear along towards the midline. That's just a good way to locate it. What you're going to do is bring your chin in and try to keep the body as upright as possible. Sometimes, again, if there's any either fat or tight musculature, you may notice that area first. Any sensation of pressure or stiffness is something that you're going to want to try to work through as a focal point first before working anywhere else. Otherwise, if you have your stone, once you get into that position, just readjust here, you could just work up the midline towards the base of the skull. So one of the things that is also important when you're trying to release the neck and the shoulders is that you don't want to tire out your arms as you're doing it, right? Because all these muscles are connected. So sometimes what you can do is support your one hand with the other one And then that way your arm is more stable. And you could just, again, work up towards the base of the skull. If you're comfortable, you can bring the chin in to stretch these muscles. Other options for the techniques is that if you have difficulty using one hand, or if it just doesn't feel that comfortable, you can even use a wall. So if I pin my arm, let's see, am I off the camera there? Oh, still on. So if you pin your elbow against the wall, then you can just lean against the wall and reach the back of your neck that way. So if I go here, so you can see, just lean against it, and you'd work upward in that direction. So when you're working on the neck, some people have more of an exaggerated curve, right, due to the chin being forward or the lower portion of the neck being a little bit more rounded. So what you want to do in that case is that you want to go past the part that's rounded and work on the curve from the upper half of the neck instead. So generally halfway and up to help release that area. So governing vessel 16 is an important point. It's classified as a sea of marrow. It's good for helping just neurologic function. And just from a general fascial standpoint, there's connective tissue that runs across the scalp. So when your eyes are open, the fascia can tend to glide over the top of the head and then aggregate and get tight in the base of the skull. So overuse of the eyes, that can help, that can contribute to these areas being tight. So what we're basically trying to do is just counter that by working up the back, over the top, and then down the front. You do that.
John,
Yes.
there's a question.
Yeah, sure. So
Are you working just the center of the neck?
Yeah, so the center is basically considered kind of just the scaffolding that everything else is hanging off of. So if you keep trying to focus on the center, eventually, as those corrections are made, you'll start feeling things off on the sides starting to pull. And then so you're basically always focusing on the center and then addressing anything that comes more to the forefront until you can resume back to working on the midline again. So, I mean, if you have something that's more pressing, you can always focus on that first. But just for this general part of just helping get the head centered in a good alignment. And then, yeah, so I'm going to get off onto some other tips too. So I'll probably be able to get at those questions, maybe one or two more slides, and then we can see if there's anything after that, if that's okay. So let's see. All right, so we're back on the share, right? Yep. Okay.
Yes, we can see it.
Good. All right. So the next point on the governing vessel, let's see. Oh, here we go. Yep, we're already on that one. So the next point from 16, we're going to jump to 20. This point is called 100 meetings. It's on the top of the head. It's the highest point on the body. And it's where a lot of the yang energy meets and connects with some of the yang channels. So both points 16 and 20 are considered sea of marrow points, recommended for neurological problems and improving the function. If there's a bump around that area, you basically just want to work from the back side, work from back to front, and you don't really want to gouge at it. You'll just work towards it a little bit if you're going deeper. Otherwise, lighten up until you can smoothly transition from up the back and then down the front, over the top of the head to about the hairline. That's the recommendation that we're going to be working with for today. So I'm just going to stop share. So the top of the head, sometimes that depends again on how your head is aligned. So the top of the head would basically be when the chin is tucked in and you're trying to keep your spine as straight as possible. So roughly on me, that would be this point right about here. So if I were using the Gua Sha stone, again, since my hair is shorter, or if somebody were able to have it braided up, I'd be working up in this position here. Or for that GV20 point, it's just good for helping your body identify its center axis so that you can position your head in a more neutral position that it prevents stress from building up in the neck just from general body carriage. So I'd be going, just make sure you can see here. So we'd be going just a little bit back from back to front, just over the top. And again, you're not trying to pull your hair or do anything too deep again because the hair's in the way, but just general kind of a brushing motion is usually good enough. Otherwise, if you have, when you pick up the jade roller, you could also use that as well to just roll over the scalp. So again, you're not going to be doing anything too aggressive through the hair, but eventually you'll be able to find some tighter spots and work on those. So now we're going to go off a little bit more onto some of the points on the sides as well. Here we go. So actually the last point here before going off, point 24 is basically just the transition at the hairline. It's called Shen Ting or spirit courtyard, and it's commonly used for acupuncture as a point to relax the body and the spirit. So again, motions from back to front. So up the back, forward, and towards the hairline at the upper part of the forehead. Is going to help support that relaxing effect, which again counters the way the fascia might tend to migrate if you were keeping your eyes open for very long periods of time. So once you're at, let's see, here we go. Yeah, so once everything is in place and the head is starting to release at the base of the neck, jaw placement becomes important before other points start to release. The jaw muscles and insertions can be stimulated vigorously but briefly and without too much pressure due to the proximity to blood supplies. The jade roller works well for this purpose. So again, so once you're tucking the chin in, again, if the jaw was too slack, you're going to start to notice that it's pressing on the airway. So part of that, it's not really about the jaw actually pressing, it's just not being held up in the right position. So what you're going to do is kind of release either the lower parts of the jaw. You can take the jade roller, just making sure you can see here, and you can just kind of press. And sometimes you'll find maybe some bumpy spots along the jawbone itself. You can angle it a little bit and go slightly underneath as well. And in terms of the jaw placement and just your focal points, you almost want to have that feeling almost as if you were holding a grain of sand between your teeth. You don't want the jaw to be too slack because that's kind of what's allowing the jaw to relax and go into the airway. So keeping the jaw just slightly engaged, and with common meditation practices, they recommend keeping the tongue on the roof of the mouth. That's going to engage the hyoid as well and just keep everything activated. So if you're working on the masseter, those muscles are a little bit more meaty, but there is a blood supply somewhat deeper. So that's where the jade roller would come in handy, where you can just cross fiber in this direction. You'll probably feel a little bit of like a vigorous stimulating sensation. And again, with the jade roller, you don't go too deep, which is good. With if you were using a stone, you want to just be careful not to use the pointed edges. Oh, let's see, there we go. Because those, if you stick it too far in, the edge will go between the muscle fibers and could aggravate the blood supply and possibly bruise. So you don't really want to do that. So again, these tools are mostly just for, the stone is better for kind of the lighter strokes on the face. Other areas that can be used with the jade roller are under the cheekbones as well, sometimes the insertions of the muscles. So you can roll a little bit underneath. And again, you generally find some tender muscles and insertions right along the cheekbone as well, where the protrusions are. And up along the zygomatic arch, which is that protrusion that kind of leads back towards the ear. You'll feel that one as well, generally using horizontal motions with the jade roller as well. You may find some tender spots there. And yes, even though I'm saying jade roller, you could also use the stone. If you have any oil with you, you may want to put a little bit. And again, if you're using this jade stone above eye level, you just want to be careful not to use too much oil, because then it can come down into your eyes over time. Then once you start getting up towards the temples, that's another good area to use the jade roller or the stone as well. And again, just using short strokes, but not too deep. And you're just looking for things that are a little bit tender, and it doesn't have to be too intense. But the temporalis muscles actually go fairly far back. They cover a fairly good area. So what you want to do is you don't want to go with too broad strokes, because sometimes the tension is a little bit stubborn. It's good to start in the front and just gently keep going back and forth until you feel that you're at an appropriate depth. Once it starts to release, then you'll feel that you're able to push further in that direction, if that helps with the instructions. Yeah. And again, sometimes if you do feel that you're pulling the hair, you can use the stone and just kind of go in with just a little bit of a nudge. You're just kind of like sinking in just a little bit and rubbing just a little bit. It's almost like you're using an eraser, right? Just a few movements, settle back and forth, and then you can go on to another location. But again, you just don't want to make it too intense. Let's see. All right, so for releasing the posterior neck, the muscles in the posterior neck are fairly straightforward, and you don't really need a lot of anatomical knowledge. So I'm just going to give some general tips on that one. So without going into too much detail, the most common recommendations are to apply Gua Sha vertically along the midline and diagonally downward and outward while you're branching off the midline towards the shoulder blades. Again, we're basically following the musculature of the trapezius fibers, working parallel to them, and that these directions are mostly applicable to the upper trapezius muscles. As you get below the shoulder blades and into the thoracic vertebrae, they change direction. So we'll cover that in another workshop. Some of the trapezius fibers also insert on the clavicle. So as you're working again from back to front, you just want to make sure that you're kind of following towards the tip of the shoulder and a little bit on the front before working on the sternocleidomastoid and the scalenes. And again, with those areas, you just want to be careful with the blood supply again, not to dig too deep if you're using a stone. The platysma is a muscle that I don't believe everyone has, but you can expose that one while grinning. So I'm just going to stop share again. So again, so I'm just going to turn my back a little bit here. So again, initially I was talking about working vertically along the midline. Again, starting from the upper half, working upward. Once you feel comfortable carrying your head in a good alignment, then what you can do is work away, so downward and away from the midline in that direction. So you have that GB17 point right at the base of the skull. I'm sorry, GB16 right at the base of the skull. You can also work slightly horizontally along the base of the skull towards the tips of the ears, just creating a large region as you're working, going down from the back to the front. And then again, the trapezius fibers insert a little bit on the anterior side as well. So what I'm going to do here is use my, let's see, good contrast here. So if this is the hand that's going to support, and this is the one that's got the stone, you're going to reach across and support that elbow. So now you'll be able to reach the trapezius fibers more easily, working back to front, right? So that's going to help work kind of the upper shoulder blade, more meaty aspects of the trapezius. And let's see if I got here, if you can see the broad curved aspect of the stone is going to be good for getting into that. and you can just settle into it with the heel of your palm, follow those fibers. And again, you don't want to rush working from back to forward. You just want to keep kind of, it's almost like ironing. You just want to keep going over gracefully and smoothly until you notice that there isn't as much resistance. And you're just going to slowly test those borders until you can find new areas that you can transition to without actually having to like push too hard anymore. Again, with the Gua Sha, you're basically just trying to release an area till it feels fairly smooth and then expand that area. Okay. Actually, so yeah, the one more area that I forgot to mention was the Platysma. So that's an area, so that's a muscle that connects the lower jaw up towards the fascia across the upper chest and crosses the neck. So if some people, if you grin or pull the teeth back, you'll see striations along the neck. And one of my art teachers told me that this is a muscle that horses use to shake the flies off their neck. So I don't know, I guess some people can use it really, I guess fast twitch platysma can have that can have that use, but otherwise, when you tighten a muscle and it brings those tendons to the surface, it is easier to access it with Gua Sha. So if you were looking to improve your neck mobility, you could grin. I can't really talk and do it at the same time, but if you were to expose the tendons and then gently Gua Sha, you'll be accessing different fibers that are restricting the neck motion compared to if it were relaxed. All right, so for distal points along the connected channel can benefit areas at the opposite end. I have some images afterwards that we'll go through. So in Chinese medicine, typically there's 12 acupuncture channels that run throughout the entire body. There's a number of other ones as well and special points and different classifications, but I'm just going to cover some of the main ones that run between the hands and the neck related to today, what we're talking about. So lung 7 benefits the back of the neck and the immune system, and a general area helps release the brachioradialis so that the arm hangs more straight and the body can carry itself more upright. In terms of the location for lung 7, it's basically along the wrist crease near your thumb, and I'll point that out afterwards when I stop share the screen. Small intestine 3 also directly benefits the governing vessel, which is the most yang channel, helping again with the immune system, boosting overall body carriage. And again, because the governing vessel is considered the most yang channel, it helps with issues of cold as well. So let's see. Here we go. So I drew a few of the lines on top of some statues here. We have the lung channel going from under the clavicle down towards the thumb. Lung 7 is basically right at the wrist crease there. On the disc obolus, we've got the large intestine channel going from the index finger up through the anterior delts across the neck. Generally runs through the SCM muscle as well, so right over here. For the stomach channel, points under the eyes. The point up in the forehead into the hairline is generally associated with dampness as well. So one of the associated symptoms, or a classic symptom, would be somebody feeling like they have a lot of pressure, like a towel's wrapped tight around their head, or a distended sensation. But these are areas, again, along the stomach channel that are associated with that. It actually runs down towards through the quadricep muscles and the anterior tibialis as well. So for the small intestine channel, that's one of the points that I was mentioning earlier, small intestine 3. When I stop share, I'll point that one out. And that runs up from the outside of the pinky finger through most of the shoulder blade on the back and the rotator cuffs. And then it comes up around towards the outer part of the eye. and the bladder channel runs down the back. And again, this is kind of reflecting some of the movements we were talking about, moving up the back and over the top. This channel actually starts from the inner canthus of the eye. So the governing vessel would run up the midline. The bladder channel would be running from the inner canthus slightly off center and traveling down. So they're like two roads in a highway going in opposite directions. And again, so just to cover some of the Gua Sha techniques that I was mentioning, if you can see my cursor here, I'm just going to move down in that direction where the Gua Sha would go down and away from the midline. But as you start getting around the medial border of the scapula, those fibers of the trapezius muscle would be running more side to side. And then as you get towards the lower fibers of the trapezius connecting to the scapula, it would actually be running up as it goes away from the midline. So on this one over here on the left, we have the gallbladder channel that would start up around the outer canthus of the eye and then cover most of the temporalis muscles running behind the ear, running down the sides of the body, going through external obliques, piriformis, IT band, peroneal muscles, and then going down towards the fourth toe. And then over here we have the triple burner channel starting from the ring finger, rising up through the posterior delts, coming up behind the ear, and then up towards the eye again. So I'm just going to stop share and just briefly describe those 2 points that I mentioned in the notes. Lung 7. So it basically is at about the distance from your wrist, where if you had a long sleeve shirt, where the cuff would stop. And then if you just go right about to there, it's right on the ridge, if you were looking at the front here. So inside, outside, and then on the top, right? So the lung 7 would basically be on the top with the radius right around there. So part of the benefit for this point here, what you would want to do is Gua Sha away from the body towards the thumb. And what that's going to do is help release the brachioradialis tendon, which goes across the elbow. And the general effect on posture and body awareness is that sometimes when people have a tight neck, what happens is when they lean forward, let's see, do I have good contrast here? So what happens is that sometimes when people lean forward, they compensate by keeping their arms bent, right? So if you lean forward with your arms straight, it just wouldn't feel right. So again, sometimes what happens is people tend to lean forward and then there's just this natural bend in the elbow. And then even if you straighten the neck muscles, if you were to straighten the neck but not do anything with the arm, the hands are kind of sticking forward a little bit. So it's always important to help straighten the arm to keep the body and everything else all working together so that you feel comfortable in this neutral position. Again, with one with your spine and 2 with your arm being in alignment as well. So again, that lung 7 point is up on the ridge with the radius just behind the styloid process there. And then from the next point we were at, which was small intestine 3. So if you make a fist gently, just gonna try to get a good angle here. You're gonna go right at the spot right here. And that's basically it. So you've got the bone, the metacarpal, running along on the outside. You're just going to follow that slight divot right below the medius, the meaty part of it. So let's see. Just trying to get a good angle here. So generally, if you make a fist, you have the muscular meaty portion, and then right after that, you get that small divot right before the knuckle, and that's where small intestine 3 is going to be. So if you kind of tuck your finger in a little bit under the bone, you might feel a spot that's a little bit tender. And that's a spot that, again, is on the small intestine channel. It would run up over the shoulder blades, and then to help support just the general governing vessel and the awareness of the neck. So I think that's pretty much it. And I thought we'd go into questions if people have any after that.
Can you see the chat?
Oh, I think I might have, so I have a triple burner. I think that was it. If I said triple share, that might have been a misspeak on my part. Sorry, let me just.
That was my question. And so it remains, what is a triple burner?
Okay, yep, got it. So the triple burner in Chinese medicine is basically a concept of, so three, so the sanjiao is just an energetic concept of the whole body and just what keeps it warm. So three sometimes just refers to a lot. In this case, the three burners specifically would refer to the lower burner, which would be the abdomen, the middle burner, which would be the stomach, and the upper burner, which would be in the chest. So those are the three burners, and there's different models, I guess you could say, of how people choose to diagnose according to Chinese medicine principles. With acupuncture channels, there's generally 12 channels. Sometimes people use what would be called a 5-element theory. So yin and yang would be a different differentiation using just 2 principles. So the triple burner, some people specialize in that. And then, yeah, just for general diagnostics and harmonizing the body. But again, beyond those 3 burners, the triple burner also has an acupuncture channel, as I mentioned. And that's just supposed to generally support the harmony of those 3 burners and just warm the body and help with the distribution of fluids. Does that help a little bit?
Yes, would that help with Raynaud's syndrome, where the appendages get cold?
Yeah, so sometimes with that, there's, yeah, so in general, with the cold, the triple burner is something that would help with that. But also you just want to make sure that there's other things that you're looking at as well, which just be general blood supply, circulation, and those kind of things. So it's not always just about using the energetic properties. It also helps just to look at the just the physical structure as well and make sure all of that is working as well.
Good.
So the triple burner is often paired with the gallbladder channel, which is associated with the sinews and tendons. And when those aren't functioning, then you can have impingement or restricted circulation as well. The triple burner is also paired. All the meridians have yin and yang pairs. The triple burner is considered more yang. The yin pair of that would be the pericardium, which is a fire channel that runs from just off center of the nipple through the flexors towards the middle finger. And that channel helps control the movement of blood as well. So if there's any impingement or tension on the front, the intercostals or pec minor and those kind of things, that could also affect the yin pair of the triple burner, which would be the pericardium.
It's complicated.
Yeah, a little bit. I mean, the main thing is basically just to start with one spot, get comfortable with the anatomy, get comfortable with the sensations, and then just kind of build off of there. There's an infinite number of places to start, right? But you just got to start somewhere, I guess.
Would you suggest that we work away from the heart?
Yeah, so in general, for Chinese medicine, the heart is considered the emperor. So normally it's not a good idea to get the emperor upset. So a lot of times they usually try to just keep the, so the emperor is not supposed to see the battlefront. The emperor is not supposed to see all those troubles, right? It's just supposed to kind of sit there on the throne and be happy, right? Yeah. So especially some Japanese styles of medicine or Chinese medicine, they really try to avoid even, sometimes they won't even needle the heart channel. They'll say anything but the heart channel. So yeah, there's a certain aspect of the spirit being associated with the heart that has a general caution for being too aggressive or just for the modalities. That's something that's that the heart is something that's supposed to benefit indirectly from everything else all coming together in general.
I think there's a few more questions in there. Yeah.
Yeah, so for people that tend to bruise, sorry, the bruxing. Yeah, so for teeth clenching, that is something that it can help with a little bit. Again, the temporalis muscles and the masseter are usually pretty good areas. And one of the, I believe I mentioned during the slideshow too, is that it's important when you're doing the Gua Sha to be careful of wind. For Chinese medicine, they say that there's a certain blood deficiency that can contribute to wind as well. So yeah, so for the teeth grinding, I've worked on people manually with acupressure and helped them with TMJ. And my impression is somewhat that when the teeth are clenching, they're trying to reset because there's some kind of muscle imbalance. So when you're correcting the muscle imbalances, you can look at the muscles themselves to release, which would be the temporalis primarily and the masseter. And then also looking at imbalances from other parts of the body as well. So front of the body would be these muscles here, and then the relationship to the back. So the gallbladder channel is often associated with pathogens of wind, and it governs movement of energy between the front and the back. So the gallbladder channel is one area that works on the temples, IT band, piriformis, those type of areas. Also, the base of the skull as well. The occiput, the protuberance, and the insertion of the SCM are all good areas to work on. Again, just because sometimes people, if you overuse your eyes or even ears, some people listen to a lot of music or so, but any type of imbalance of stimulation between the eyes, the ears, and resting, where both are not really being used, those can just lead to imbalances of the muscles as well. Yeah, so with the strokes in the Gua Sha, I generally recommend just to start going up the back, over and down, because it's very common for people to overuse their eyes. Just again, with so much artificial lighting and those kind of things, where it's very common. But basically, once the tissue is healthy, the circulation should go in any direction, and it won't really matter too much which way you go. But again, just for promoting that common tension at the base of the skull and helping straighten out any corrective work there, I usually just recommend that. But again, once that starts to release and other things start to go, you may feel that it's more comfortable to get the adhesions a certain way. But again, once you start to get in there and release things, you kind of get a better sense of what you're looking for and how to reach those. So let's see. Oh, and let's see, do I lift between strokes or is it back and forth? Yeah, so generally lifting between strokes, because what happens is when you release an area, let's just use my hand as an example, right? So if I'm working towards my middle finger here or towards the fingers, I'm working up and let's just say I feel a bump, right? So if I start at the center of my palm and I'm working outward, I may feel a bump. That's the active part that you're working on, right? Because everything before that is somewhat smooth. If I work towards the bump and then pull back, what you're doing is you're kind of confusing the movement of the blood and you're not really leveraging it to work through the adhesions. So again, when you're doing a more consistent push in a certain direction, you're moving the interstitial fluid and sometimes blood that's stuck in a certain direction so that it pushes through the fascia and allows it to open up a little bit more. So you get more leverage with pushing in a consistent direction. Also with the acupuncture channels as well, if I were maybe brushing along my arm in a certain direction, even if you're going very light, you'll still feel a certain release that you won't get from going back and forth, unless you're maybe training for a certain type of activity or a sport where you need to have a certain reflex where it helps to go both ways. I'd usually just recommend longer strokes in a similar direction. or working towards that. Starting short, maybe if you feel that there's an area specific, going deep, but then continuing at that depth until it eventually works out to being longer. Let's see. And were there any other questions?
Will you take a question about the last workshop?
Yeah, sure. I don't have the slides right on hand, but you have the question?
Yes.
Yep. Sure.
You gave us 3 tools.
Mm-hmm.
Okay.
Yep.
Please refresh me. What are there specific tools for certain areas of the body?
Mm-hmm. Yeah, so for the most part, the most important thing to look at with the variety of tools is finding the tool that fits best in your hand. I would say that would be the first priority. And then after that, generally, there's one that you have, I believe, on the, is that your left hand? Which, yeah, that one there.
The tooth.
Yeah, so that one there has a space in the middle. Sometimes that is good for working around bone. But generally what I like, if you had somebody else working on you and they were trying to work on the midline but avoid the spine, that's an area where that might work. I generally try to have as few points of contact as possible though, because I think, again, with trying to build leverage in the movement of the blood, sometimes those 2 points can send conflicting signals. So for something like that, I find that it would probably be more useful using the broad arc, possibly on a leg. So you see how on that tool that you have, right? There's those 2 knobs, right? And then you have that long side of it, right?
Yeah.
Yeah. So that that part that's bowed inward is good for conforming to parts of the body that are larger, rounder, or more meaty. I'd say probably like a thigh or something. Yeah. Or yeah, those areas would probably work pretty well. Thighs, calves, mostly lower legs. And then you could use those 2 handles on the side just to, again, get better leverage with your hands.
Okay.
Yeah, so for this tool here, right, the one you have that's pretty similar to that, right? There's a number of different ways that you can use that. I think one of the ways that I instructed last time was to take that wedge and you can basically, let me see, basically put that notch right over your thumb, right? Let's see, that shows, all right? Right, and then that's going to allow you to not rely so much on your finger strength, but the metacarpals when you're using the Gua Sha. Let's see if I can turn that a little bit, right? So if I don't utilize that notch, what I'm doing is I'm pinching the stone, right? So you can see I'm not using that heart shape, that wedge, right? I'm just pinching it with my fingers, and that could lead to sometimes your fingers can cramp. So that's where the utility of that can come. And then again, this one has a little bit more of a rounded outward edge. So that can tend to work for between the muscles and the fascia along those as well. So if you were to like look at the forearms, and sometimes there's little striations, you could just take it and kind of settle in cross fiber as well. In those kind of areas, it allows you to reach in. But again, it's pushing outward. It's going to allow you to get in there a little bit more easily. And then same thing for that edge. That little edge is going to allow you to get into smaller spaces as well. So for that type of edge, I would usually recommend around maybe the shoulder. That's separation between the front anterior deltoid and the pectoralis muscles, and near the coracoid process. I think I put that in there as well. There's usually some tender areas under the clavicle in that divot and around the ribs where you can just cross fiber certain muscles there.
That feels great.
Yeah, and for those areas, you can just take your hand if you want to, and you can put it behind your back as well. That's just gonna, let's see if I can step away for a second. So if I, let's see, here we go. Right, so I take this hand, put it behind my back, and now when I work on that side, it's going to expose some of the pec muscles a little bit more. And just for general shoulder mobility, being able to do that behind the back reach, right, where you're trying to go before you reach towards your fingers with both hands, this is just a generally good position that where you can improve your mobility.
Thank you.
Sure. And yeah, so in line with that, in terms of reaching behind the back, another thing you can do when you're working on your neck, because again, people are asking about just working on the midline. Well, sometimes when people have stiff necks, it doesn't bother them until they try looking side to side, right? So if you take that hand and put it behind your back, right, then you can start working on Gua Sha and testing your range of motion. So if I put the hand behind my back, my right hand goes behind my back, I can try looking to my left. That's really going to open up some of these muscles here in the front and allow me to work on them without damaging the blood supply. So again, earlier I mentioned that if you're working on those areas deeply and the muscles are relaxed, the stone is going to sink in and you're actually going to bruise either the veins or the arteries. So if you put the muscles in the neck on stretch just slightly, you're going to be able to access those more easily without damaging the blood supply. So again, if you put your right hand behind your back, look to the left. If you feel any muscles that are being stretched, those are the muscles that you want to work on. Ideally, if you had unrestricted motion and unrestricted mobility, none of those things would be coming to the surface. You wouldn't be feeling any of those. So sometimes if you're not really sure about what areas to work on, just try a stretch and then see where the stretch is limiting you, and you can do Gua Sha on those areas where the stretch is. Let's see. Yeah, so in terms of danger with the blood supplies, the main thing is that with veins, generally bruising is something that could occur if you were working very vigorously. So not so common on the neck. Generally, as you start to release muscles along the neck, what'll happen is that everything starts shifting and your arm might even start to feel sore or tired because your arm hasn't released to keep up with the neck. So that's usually what I would notice. But other than that, again, most common areas for bruising probably would be the flexors of the body, and sometimes either the inner thigh areas. Those areas are probably the most susceptible. But like it does take a fair amount of work, and this stone, the ones that you're getting really don't have a hard enough edge, and they're not sharp enough. So like if I were to just kind of put this on and really just push against the return flow from my elbow towards my wrist, you could would probably cause a bit of a backflow in the veins. But I mean, you'll normally see the veins start to bulge or something like that. But even in the neck, not necessarily. It's just a general caution. But unless you really have issues with bruising easily, other than that. But if you're working on the surface, I would say generally no, and especially on the upper part of the body, because those deep blood supplies in the neck aren't really influenced too much, because you're not doing a continuous pressure as well. It's just those intermittent strokes, and you're giving the blood time to move in between. Yep. And I think that was, oh, with the roller. So with the roller, you actually can go a little bit more back and forth, just because, again, you'll just kind of lighten up and go into it. It really is just about getting more of a rhythm, and you start to feel the release. It's a kind of like scratching an itch. When there's a certain level of intuitiveness to it that comes with it. But yeah, with the roller, I would still recommend going in a similar direction if possible. But again, it really depends on the area. You can slowly go back and forth, but if you do, I would generally use fairly short strokes, because again, you don't want to push the blood too much all over the place. You either want to move it in one direction, help it course across the joints, improving other muscles, or if there is just one area that's very stubborn, like let's just say there's a spot in my palm and I were to go back and forth, it would basically be, again, like that, like you're erasing something, just kind of vigorous and fairly short movements. And so I think okay for today if there aren't any other questions? Or...
Thank you, John.
Yeah, sure.
Amazing as usual.
Yep.
We hope
Oh,
that
so I
you're
also
gonna-
had, sorry, I had the contact information if anyone wanted to write that down. I could email them the slides as well. I'm just gonna. So one person did email me last time for those, and I provided them. But after that, then we're good to go. If you want to say anything else, Hillary.
I'm just gonna type this into the chat as well.
Yeah. So my email address is at that website. I guess I'll put my email in the chat afterwards.
So how often should we be doing our Gua Sha?
Yeah, so if you're doing the Gua Sha and you're getting those red marks or the red sand, if you're doing those long scraping movements and you see those, you generally want to wait till it disappears. Everyone has different metabolism and rates of recovery, but generally I would say twice a week is probably more frequent than what is common. So once a week is usually okay. And again, it depends on other things that you're doing. If you're supplementing it with other restorative exercises or yoga or working out and those kinds of things, then you it all takes energy from your body, and you just want to budget it appropriately. Yeah, but especially if people are starting to work out again with warmer weather and springtime and those kind of things, generally you wouldn't use Gua Sha for the DOMS, delayed onset muscle soreness. So if you're working out, if you just worked out your legs and you're stiff, I'd say the very next day or two, I would generally wait about maybe 3 or 4 days before going into the Gua Sha. It's a little bit more appropriate for the chronic stagnation rather than acute, just because again, it is coursing the blood through the tissue. If the tissue is acutely damaged and trying to mend, then it doesn't really, it's not as really effective for that.
Okay, thank you. So we don't want to keep you any longer. It's already past 8 o'clock. Thank you so much. This was really wonderful.
Yep.
And would you come back and do other parts for us? Maybe go a little bit deeper into the organs and I don't know, abdominal muscles, the lower back, some things that we can reach, because I mean, upper back, we'd need someone else to do it for us, and maybe the legs. I don't know. I mean, whatever you want to share.
Yeah, I mean, in terms of Gua Sha, it's not too common on the abdomen, but I could probably group just lower half of the body.
Yeah.
Yeah.
That's
it
what I
wouldn't be
meant.
too much. Yep.
Okay, great. Thank you.
Yep, sure.
You're so wonderful. So we will see you next month.
Yep, for the Qigong.
Thank you.
No, next month we're going to do the foam roller, second part.
Yes, foam roller,
right?
then the Qigong.
And then the Qigong, yeah. Great, thank you. Thank you everyone for coming.
Thank you, Hillary.
You're welcome.
Yep, thanks.
Thank you, Joe.